I too want to share condolences with the family of those mourning the passing of their loved one at Northwood over the weekend. So this death was reported on Saturday, involved a resident at Northwood, and that brings the total number of deaths in Nova Scotia to 60. Today, it's good news again that we can report another day with no new COVID cases. So the total number of confirmed cases remains at 1,057. We remain having one long-term care facility with active cases. As everybody, I believe, knows, that is Northwood, who now only have 3 residents and 2 staff who are considered active cases. So those numbers continue to go down, which again is good news. The QE2 lab, we continue to have lots of capacity, and even though our numbers are typically very low on a Sunday, and into the Monday, we were actually tested 532 people yesterday. So our testing strategy of broad-based symptoms it continues to work. We're testing large numbers of people and having negative results. We have 5 individuals in hospital, 2 of those in the ICU, and 992 people can now be considered recovered. We've had 42,861 Nova Scotians who have been tested and have received negative results. And on the topic of negative results, the Nova Scotia Health Authority has announced today that they are now able to offer Nova Scotians the option to have negative test results for COVID-19 sent to them by email. This is for people who have a Nova Scotia Health card. So when you go in for a test, you'll be given an option to agree if you want to have, if your test is negative, to have it sent to you by email. It is optional. So if you don't have an email address or aren't comfortable with this, sending your health information, you can still receive your negative results by phone. But if you do have an email, we would encourage you to take advantage of this so you will be able to get your test results more quickly. We still will be able to, if necessary, public health will still phone people with negative results if that is their desire. And we certainly will need to follow up everybody with a positive result. Needs to be followed up with a phone call from public health so we can start giving you advice about isolation and identifying your contacts and quarantining people as necessary. If you do get a call from public health, I've been asked to remind people that that if you have been tested, you need to check your voicemail regularly. The calls that will be displayed are from an unknown number, and many people tend to ignore those. So if you're waiting for a test result, please pay attention to your phone and your messages. The results are usually delivered within 48 to 72 hours. And while you are waiting for your test results, as you don't know what your result is, you could be positive. It's important that anybody who's been tested self-isolates while they're waiting for their test results. I know that many businesses and organizations are preparing to open on June the 5th or after that when they're ready. There's certainly a lot of questions and news stories and on social media to many government departments asking about what public health protocols are and what individual businesses need to follow. I see this as a good sign. It means that many Nova Scotian businesses and organizations are looking for information. They want to do the right thing. They want to ensure that whenever they choose to open, that they are doing it safely for their customers, for their staff, employees, volunteers, anybody who's in their business or other kind of operation. Let me just, to make sure people are clear, because we are getting a lot of questions, I just want to run through how, around planning and how people submit plans and who needs to submit a plan. If you're a business or organization that was ordered to be closed under the public health order, you must follow the plan developed by your sector association to reopen. We have been working with a number of sector and business associations approving those sector plans, which are then being communicated out, and individual operations then have to follow that sector plan. Even if you're not a current member of that association, you need to follow that plan, and those associations have said they are prepared to help people who are even in their sector but who may not currently be their members. This sector association plan, as I said, has been submitted, or there's a few that were waiting to be submitted. They ultimately have to be approved by both Occupational Health and Safety in the Department of Labor and Advanced Education and through my office for a public health approval. And those plans need to show how you're going to adhere to the basic public health protocols of physical distancing, sticking to the appropriate number of people if physical distancing cannot be adhered to, how to work and interact with customers in a safe manner, protocols around cleaning, handling and cleaning of equipment, how employees can be prepared to return to work, and basic communication with both employees and customers, and so everybody's aware of the details of the plan. Those are the high-level components of what a plan will be looking for with any plan sector plan that we're reviewing. For some sectors, such as restaurants and bars, there are additional requirements in the public health order, and we're working directly with those sectors so they're aware of those specific requirements. So if you are, for example, if you're a restaurant, you need to follow the Restaurant Association of Nova Scotia plan and apply that sector plan to the specifics of your own restaurant. If you own a hair salon, you need to follow the Cosmetology Association of Nova Scotia plan and apply it to your own salon operations. If your business was ordered by public health to close and you do not have a sector association, you're expected to develop your own plan and submit it to government for approval, and then you can submit it to Nova Scotia Economy or nsEconomy@novascotia.ca, and that email is on our Reopen Nova Scotia website, and I'll give you that URL in a minute. As those plans are approved, we're asking people to post them on their own website, and we are then linking to those from the government website. It's an important way that we can demonstrate to the public about what the plans are, and they have confidence around safe reopening. For businesses who were not ordered by public health to close but may have closed for a number of reasons, you should have a written plan. It should follow the same protocols that I just listed for organizations that were closed. But you do not need to submit the plan. But having a written plan will help you think about the risks in your operation, put measures in place to address them, and will be something that you can use to communicate to your customers and clients that you are understanding their and respecting their safety, and the same for your employees. So there's more detailed information on this at the government website, and that's novascotia.ca/reopen Nova Scotia. And that website has a number of other tools and guidance information to help a range of businesses prepare to reopen. I know that some people are looking for a large, lengthy document that spells out in exact detail how to operate during a pandemic, and looking to government to provide that. But every business is different. Every business owner or organization knows their own environment best. So we have providing people the necessary public health protocols and guidance that need to be in place so they can operate safely, and then asking organizations and associations to develop plans with the knowledge that they have of the work that they do. And that's why I've been doing this consultation for the last several weeks, and we're having more discussions to clarify information in this week and next week. It's important that people understand the rules and the public health parameters with which they need to operate, but we also as government need to make sure that we give them the space to come up with a plan that works for them, and we're certainly encouraging people to think innovatively and creatively about how they could meet the necessary public health requirements.